Hi, how are you today?
Fine.
Go ahead and wash my hands. My name's Lance. I'm going to be your nurse today.
Okay.
Tell me your name.
Stephanie Miyake.
Okay, Mrs. Miyake. Do you mind if I call you Stephanie or Miss Miyake? What do you prefer?
Stephanie's fine.
Okay, well, it's nice to meet you. So I understand you came in for just a general physical today.
Correct.
Do you have any other pain issues, complaints, anything that's kind of out of normal for you?
No.
No?
Just my annual physical.
Just annual physical. Okay, well, I'm going to go ahead and kind of look you up and down, do a head-to-toe assessment. If at any point you have any questions for me or you feel uncomfortable, anything like that, please just let me know. Stop me, do whatever. Say, hey, guy,
Okay.
let's hold off, all right?
Okay.
Okay. So I will, be putting my hands on you, just looking you over. I'm going to go ahead and listen to you at some point, shine the light in your eyes, that whole normal shebang. All right, so let's go ahead and get started. I'm going to go ahead, start off with your head. I notice our head is normal cephalic. Ears are symmetrical. The tops of them are even with the eyes. The palpable symphysis. Looking there, your hair is resilient, clean, non-oily, no dandruff. Feel tender at all when I touch you?
No.
There's no palpable lumps, anything like that. No parasites, no lice, anything like that. Everything looks good and healthy. Of course, I've already gone ahead and taken her vital signs, so I do know that her blood pressure is 118/78, heart rate 68. She says she normally, hangs out in the 60s anyway. Temperature 98.6, respiratory rate, breathing about 14 per minute. O2 sats is 99%, and there is no pain. She's 0 on a 0 to 10 scale, so everything's within normal limits and the vital signs.
Right.
Yeah, always a good thing to have normal vital signs. Okay, so we've gone ahead and looked at her head. When I look at her face, can you go ahead and smile for me? Smile. Okay, close your mouth, make a frown, puff up your cheeks, raise your eyebrows, close your eyes. So when I'm testing that, I'm seeing that cranial nerve number 7, or facial motor nerves. Everything is intact with that. If I wanted to test cranial nerve number 5, the trigeminal nerve, I'd have like a piece of cotton or something sharp and touch her here above the eyebrows, both sides, asking her if she feels each time. Also the cheeks. I'd have her eyes closed when I'm doing this, of course, and then the mandible area. And hopefully she'd feel each time bilaterally. I'll go ahead and say that she did. So moving on, I'm going to go ahead and look at her eyes. Ideally, I would have an ophthalmoscope. I do not, so I do have a pen light. I'm going to go ahead and shine a light in your eyes. Just go ahead and take a look. Just right here at my shoulder, okay? When I do that, I notice that her pupils are equal and reactive to light and accommodation. With the ophthalmoscope, I would look right in through her pupils, looking for the optic disc, making sure that there's a consensual reflex. Of course, I'm doing that with the pen light as well. And the reflex to direct and consensual. What that also allows me to do is to look at cranial nerves numbers 2, 3, 4, and 6. So 2 being the optic nerve, 3 oculomotor, 4 the abducens, and 4 is the trochlear, 6 is the abducens nerve. Can you go ahead and follow the pen? This is also allowing me to check those nerves up, down, and she's able to follow and out. There's no nystagmus or anything like that. So eyes are all looking good. I move on to ears. As I already told you, notice that her ears are even set, the tops of them, with the palpable symphysis. The eyes, the inner and outer canthus. She doesn't have any drainage out of the eyes, by the way. If I had an otoscope, I'd pull up and back on her ears, looking through, shining the light, looking for a light pink to clear tympanic membrane, and the eardrum's intact. Looking at any excessive amounts of cerumen or earwax. She doesn't have any of that, no foreign objects. Go ahead and do cranial nerve number 8 test. I'll go ahead and whisper something. Say,
Bullwinkle. Rocky.
Okay, so I know that cranial nerve number 8 is intact. Hearing that. But also, if I had a tuning fork, I could test conduction, banging on the table, hold it against, first of all, the bone here, and then down on her shoulder, and she'd tell me when it stopped. Hopefully air conduction being down here rather than bone conduction is greater, she can hear it more. And then I would also make sure they're even, testing again up here until it stops, and hopefully she hears evenly on both sides. Of course, notice that she does have earrings. We've done the whisper test, and that's pretty much what you do for the ears. Moving on, I look at her nose. I'm going to go ahead and shine a light up your nose. You can tilt your head back just a little bit. Notice that there's no foreign bodies, no excessive drainage. Mucosa in her both nares is pink and intact. Septum is midline. Can I go ahead and have you occlude? Hold off one nostril, one there. Take a deep breath in and out. The other one, please. I know that they're patent. Good. Close your eyes for me. Do the same. Go ahead and take a deep breath right now. What did you smell?
Coffee.
Well, there you go. So now I know that cranial nerve number 1, the olfactory nerve, is intact. Let's see. We move on to her mouth. You go ahead and open your mouth for me. Stick out your tongue. Say ah. Okay. Let me see your teeth. Big smile. All right. So notice that she has, white intact teeth. Great dentition. Oral mucosa is moist, pink, and intact. Same with her tongue. Her tonsils, they're +1, so within normal limits there. Uvula there is midline. Oral pharynx, looking at her oral pharynx, also her soft and hard palates. Everything looks to be intact there. I'm also, at that point, testing cranial nerves number 9, 10, and 12. Can you go ahead and give me a big cough, too? Awesome. If I had something for her to swallow, maybe give her the coffee or anything like that. Cranial nerve number 9, the glossopharyngeal. Number 10, the vagus with the cough. 12, the hypoglossal, the ah. So tested all those, and they're looking good. Moving on, I'd move down, checking out her neck. I'm going to go ahead and put my hands on you. I'm going to feel for your nodes, okay? Your lymph nodes, see if anything's swollen. Let me know if anything is tender like that, okay?
Okay.
So I go ahead and start off the occipital, kind of behind the back, posterior cervical. We can go ahead and deep cervical, anterior cervical, super deep or subclavicular. Go ahead, tonsillar, postauricular, preauricular, tonsillar, parotid, submandibular, and submental. Those are all intact and non-palpable, not tender, don't seem to be inflamed by any means. So know that her lymph nodes are good. At the same time, I can test out, make sure the carotid pulse, equal on both sides. Want to be careful not to palpate at the same time. Don't want to make her pass out, of course. Using the cup side or the bell side of my stethoscope, listen for any bruise. There's no carotid bruise. If I heard that, that could indicate some type of stenosing. There's some debate on that, whether that's actually true or not, but that's what that could possibly indicate. Can you go ahead and turn your head from side to side? Good. Back, forth. No difficulties there. Thankfully, kind of ruling out some meningitis at that point also. There's no stiffness in the neck. You go ahead and shrug your shoulders for me. Shrug them up. I'm pushing down. You can withstand that. So cranial nerve number 11, the spinal accessory nerve, is intact with that. Let's see. I guess that's pretty much it on that. She's got, good strong pulses in the carotid. So moving on, go ahead and looking at her thorax. We're going to look at that anterior, laterally, and posteriorly. We can go ahead and feel for any firmitus. Sorry. Tactile firmitus. Can you say 99 for me?
99.
Again?
99.
We went posteriorly.
99.
Now I would move down.
99. 99. 99.
Okay. Also feeling for any abnormalities again, any lumps, anything like that. We're constantly assessing the skin, constantly checking for moisture, lesions, anything like that from the moment we start looking. So the skin, is pink, warm, dry. After palpating the thorax, go ahead and I can percuss. So I can start at the apices of the lungs. Notice that it's resonant. Can do in the intercostal spaces, posteriorly as well. Okay. also want to auscultate the lungs, knowing that there are 3 lungs on the right side, 3 lobes on the right side, 2 lobes on her left side. I would listen to them symmetrically. Each time I place my stethoscope on you, I'm going to go ahead and have you take a full inhalation and a full exhalation. Each time I move that, I would have you do that, okay? For purposes of time here in this video, I won't go 6 places front and back, and do it a couple times each side. But knowing that I would kind of do a ladder movement, starting at the apices, down, left, right, laterally. Again, same time on the back. We'll go ahead and do the posterior side, all right? As we're listening, go ahead and start. Take a deep inhalation and expiration. Through your mouth, please. As I'm doing this, I'm kind of moving down and laterally each side. I'm listening for vesicular sounds, bronchovesicular sounds. Vesicular, obviously in the outer parts. Sorry, that's my phone making noise. Bronchovesicular sounds up here in the more proximal area. Also, making sure trachea is midline, no deviation. When I was looking at the neck, we're also looking for thyroid. Did miss that part on the neck, just to let you know that I did look at that. Do you have any difficulties breathing? I noticed that when she breathes, there's an even rise and fall of the chest. If I had a table here, I could lay her down and put both hands on her stomach, take a deep breath in and out, and I'd watch how, as I'm using skin folds again, in and out. And I'd watch how my thumbs move in and out, make sure that they're even, there's an even amount of movement. We could also check diaphragmatic movement. We can do it anteriorly or posteriorly. Have her exhale completely, and deep breath in, exhale completely. As I percuss down, I would percuss all the way until I feel dullness, make a mark there, and then have her do a full inhalation, hold her breath there, percuss all the way down until I feel dullness. There should be about a 5 centimeter difference there. So that would be, she's got a regular rate rhythm. She's not using any type of intercostal muscles, any accessory muscle use, no nasal flaring, lungs sound clear. There's no rales, no rhonchi, no wheezing, no crackles, fine or coarse. So it's good. Your lungs sounding good.
Good.
Okay. You got any coughs or anything like any colds, anything like that lately?
Not lately.
Okay. We'll go ahead and move on to her cardiovascular system and listen to her heart. Start over the right substernal to listen to the aortic valve, moving to the left. Do that for the pulmonic valve, moving down to Erb's point, moving further down. Go ahead and listen for the tricuspid valve, and then down to the apex of the heart. I would listen for the mitral valve. I'm going to go ahead and listen to that, listening for S1, S2, possibly any murmurs, anything abnormal. Hopefully only hearing S1, S2, no gallops, S3, S4. Okay. Got good S1, S2 sounds. Everything's within normal limits there. I would also do a full breast exam. You can go ahead and raise your hands above. There we go. Hands on hips. And then just relax. Relax your arms. As I do that, I'm looking for motion in her breast, looking for any like dimpling, retraction. Ideally, she wouldn't, have her shirt on. Looking for symmetry. And then I would also, we can go ahead and palpate nodes. You palpate in multiple areas, deep and superficial, for under axilla, for any tenderness, anything like that, any inflamed lymph as well. And then I would go down in vertical lines, starting here, down below, feeling for any abnormal lumps, again, tenderness, anything out of the ordinary, making sure, again, that there's no dimpling, retractions, anything like that. Go ahead and move on to the peripheral vascular system. I personally like to start with the extremities. I know that if I've got equal pulses in my furthest extremities, I know that I'm going to have equal pulses. The more proximal you get to the body's core. So I would go ahead, checking radial pulses. You can just relax. Good. She's got good radial pulses. At the same time, I can also look at her cap refill and her nails. As I'm doing this, I'm always looking at the skin as well, making sure that there's good cap refill along the way. There's no clubbing, any horizontal lines under nails, anything like that. So she's got good, strong pulses, bilaterally equal in the radial. I would check the brachial pulses. Same thing. Femoral pulses, popliteal. She's got her shoes off, which actually makes it helpful for me to go ahead and feel her posterior tibial and then her dorsalis pedis. And like I said, if she's got the dorsalis pedis and her radial pulses, I know that all the other pulses are likely going to be just as good. Also, while I'm looking for that, feeling for any edema and especially bony prominences, on her shins, bony spots on her wrists, and she has no edema. So it seems like the peripheral vascular system is looking good too. There's no type of cyanosis, no examples of any abnormalities in the peripheral vascular system. And that would conclude today's video. Do you have any questions for me?
No, I don't know half of what you said, but thank you.
Oh, all right. Anything else you'd like me to go ahead and look at today?
I don't think so.
Okay. Well, I'm going to go ahead and make some notes, and I think you have a passing grade in your annual physical.
Yay! Thank you.
All right. You have a good day. It was nice meeting you, Stephanie. Have a good day. And that concludes the video.